evening. I'm Sam Page. I'm your St. Louis County Executive. As a medical doctor, I understand how the coronavirus can impact our region. This is a serious challenge, but our public health professionals are prepared, our hospital systems are resilient, and our best experts in our region are working together to make sure that we limit the impact of the coronavirus on our region. We have prepared for this, and we continue to educate the public about all the resources that are available in county government. The patient has contacted our coronavirus hotline on Thursday, March 5th, and on that same day, the county health department instructed the patient and her family to self-quarantine at their home in Ladue. We relied on common sense and goodwill towards their community to self-quarantine. The state health director learned yesterday afternoon of the positive test results and contacted our county health department. And then in coordination with the state health director and the CDC, our communicable disease control services manager informed the patient of the presumptive positive result. The way the family has reacted to this situation is really a tale of two reactions. It is a study of how people should and should not react to the coronavirus. First, from everything we can gather, the patient had conducted herself responsibly and maturely, and she is to be commended for complying with the health department's instructions. Second, the patient's father did not act consistently with the health department's instructions. Instead, last night he decided to take his other daughter to a school function. We learned of this today, and as a result, the county health directors informed him today that he must remain in his home, or they will issue a formal quarantine that will require him and the rest of his family to stay in their home by the force of law. The role of the St. Louis County Health Department in this process is threefold. First, we will be prepared. That means we monitor the status of the outbreak, its process in progress across the globe and regionally. We will coordinate with state and federal governments and with healthcare institutions here locally. We will plan and identify state-of-the-art strategies and evaluate options. We will continue to educate. We will regularly provide reliable information through social media, through our website, and through our hotline. And that hotline number is 314-615-2660. We will continue to educate. That means we will provide reliable information to the public through our hotline and through our website, stlcorona.com, and through social media. We will mobilize. We will strategically activate our resources when needed. We will collaborate and work with our regional partners to fight the outbreak, and we will deliver. We will quickly get available resources to the public who need them. And we need to remember, prevention is the key. That means frequent hand washing with soap and water for at least 20 seconds, using alcohol-based hand sanitizers when soap and water is not available. Avoid touching your nose or your eyes or your mouth, especially with unwashed hands. Cover your nose or your mouth when you cough or sneeze. And avoid contact with people who are sick. If you are sick, stay home and avoid contact with others. And we, again, follow the CDC recommendations and our recommendations here locally. If you are in contact with someone who is symptomatic and who has traveled to an area where this disease is known to be a problem, or if you are in contact with someone who has a known diagnosis, then your instructions are to self-quarantine. And I'd be glad to answer any questions.
How many people were at the father-daughter dance last night? Were there other schools in attendance as well?
I don't know that.
Can you talk about the exact timeline of when the family was told about the positive diagnosis?
That was sometime yesterday evening between 6 and 6:30. It takes several hours to prepare for a formal interview. The initial part of that formal interview must be delivered by law and by regulation at the time of being informed of the diagnosis. The initial part of that interview took 2 hours, and it is ongoing.
So do you think that this father knew about the positive diagnosis before he left his house and went to this father-daughter dance?
We have been in contact with the family since they first contacted us on March 5th. Their communications with us were daily and multiple times per day. Our constant feedback was that they were to self-quarantine. All of the feedback we got from them is that they would comply with those instructions. We had no other expectation.
Will you all continue to let people go home if there are more presumptive positives, since you guys kind of see that some people maybe won't obey these requests to stay home?
The patient in this situation reacted remarkably, maturely, responsibly, and followed all the instructions to self-quarantine. From all of our indications, she has followed our instructions. People are better off at home than they are in a hospital setting if they don't have any requirement to be hospitalized, if they don't need supplemental oxygen, if they don't have trouble breathing.
What do we know about the spread of this disease through folks that don't show symptoms, and have other members of the family been tested?
We do not have a test that is effective or reliable for someone who is not symptomatic. And since the other members of the family, including the father, have not shown symptoms, there would be no test to confirm the presence of the disease.
Do you know anything about the spread of it with folks that don't have symptoms?
We do believe that it is possible because sometimes symptoms are so mild. It is certainly possible. This is a new disease process that we're still learning about, so we don't have good information on that.
What is the county going to do, or what can the county do to ensure that this family will self-quarantine?
We've communicated with them in a letter this afternoon that we expect them to follow our guidelines on quarantine consistent with our previous instructions starting on March 5th. And if they do not do that, we have the ability under law to force a quarantine.
Do you have a system in place, though, to know if they don't? How will you know?
We are not currently monitoring the family, but we will certainly be paying attention.
What is...
I have a question about the school. The school closed Monday for 1 day. Do you think that's good enough? And also for the Ritz-Carlton, the hotel, we don't want to make it too bigger, but do they need to do something?
The Ritz-Carlton will follow their own procedures and policies and will communicate with our health department to make that decision. A decision on school closures will always be made locally by the leadership of that school in consultation with our health department.
So not by county or by...
No, the county is not currently recommending closures at this time. We are in a process, certainly this is a mitigation strategy to avoid contact, but we believe at this point exposure has been limited. The county is spending a lot of time now, and the state health department has provided us extra resources, boots on the ground, to track down all the close contacts of the involved patient and any of the events last night. And we're in the process of tracking those down. It takes a long time, and we started this afternoon.
Dr. Page, were all of the family members told to self-quarantine?
Yes, it was clear.
Okay, because yesterday you guys had mentioned the parents were self-quarantined with the patient, but the other daughter wasn't mentioned. Was that just a protection of privacy?
All the family was told to self-quarantine. It was repeated on a daily basis several times a day over the past, since March 5th.
Are there any more siblings or people in that family?
I don't know. Does family have any more siblings? We believe there's only 2. That's what I've been told.
How many grasps does the county have
One
on...
time. Yes.
How good of a grasp does the county have on where that patient's been, and when will that information be available?
So it does, in all honesty, it takes a couple of days to track that down. We need a lot of people to talk to a lot of people. We're still getting in contact with them, but we have our own health department staff doing that. We have help from the state health department to track down everyone who might have been in contact. We do recommend that anyone who develops any symptoms of an upper respiratory infection to immediately call our hotline, 314-615-2660, and we will give you instruction based on your symptoms and your exposure history.
You mentioned the quarantine instructions were given to the family. Can you talk to the public about what those quarantine instructions are? I mean, anyone, whether it's this family or somebody else
Stay
that
in
gets...
your home.
It just completely.
Stay
Don't
in
leave
your
it
home.
Yes,
Quarantine means stay in your home.
Yesterday there were 3 pending tests. Are there any updates on those today or anytime soon?
I believe that we have heard that the two other tests from St. Louis County were negative, but we have other tests that have been sent.
When did the infected woman land in Chicago?
We believe March 2nd. We are still conducting a very extensive interview, and as we learn, you go back and ask the same question again, you might get a slightly different answer, and that's why this interview process is so complicated. That's why it's a rule of law and regulation that when you inform someone of a positive test result, you immediately begin an extensive interview. The first phase of that takes 2 hours, and the interview is currently ongoing.
Dr. Page, can you talk to the public who might have some distrust in their government, whether it's their local, state, or national government, about all of this when there are conflicting things, whether you guys knew or didn't know that the family was going to leave their house. Can you speak to the public on the efforts that you are doing to give all of the information as you know it?
Sure. Well, we depend on common sense and goodwill of the people that we communicate with. And when we ask someone to quarantine, and they tell us they will, we have to trust that will happen. We're not in the position, we're currently reviewing our quarantine policy, but I can tell you this is being done at the national level, and there are no national guidelines on when to implement a quarantine. We're following that and looking at the policy across the country.
Can you talk to us about?
Let's just take one more question, two at the most, and then he will want to wrap things up here.
You said that if they don't follow the quarantine request, that you guys could do something to enforce it by law. Can you go into that?
Yes, we can go to court and get a court order by law that will require them to be to remain in their house by order of a sheriff.
And at this
Department
point,
of Health has any control on that family?
Yes, the Director Department of Health has the sole authority to issue a quarantine. At this point in time, we're depending on our community to use good judgment, to act in good faith, to act responsibly. And if you're around anyone who has symptoms and who has traveled to an area of risk, who has symptoms, who's been around someone who has a known diagnosis, or has been exposed to someone who has a known diagnosis, then we expect you to self-quarantine and contact us immediately.
Tetrage, what do you want to say to the people that were at this dance? And do we know how long the family members were at the dance?
Yeah, we're still collecting that. Honestly, we're still collecting that information. We've been working on this for a few hours. We have our own public health department out collecting information and contacting people. We have resources from the state health department who are also helping us collect information. I would say the same thing to anyone who has concerns, to call our hotline, our health department hotline, and tell us about your concerns. Tell us about your symptoms, and we'll help you answer your questions.
Was nobody else, did they just go from their home to the dance?
We're still answering all of those questions. This story is a few hours old.
Thank you, everybody.
When did you guys learn that they went to the dance?
Early afternoon.
Early afternoon.
What time? Between 6 and 6:30.
Hey, Sam, we have one
just to confirm, at this point, this family has not even had maybe a casual conversation with law enforcement. Law enforcement is not involved at all.
No, we are depending on the family to exercise good judgment, to recognize that this is serious, that we expect a quarantine. We've communicated with them in writing again that we have the authority, our health department director has the authority to issue a quarantine. To our knowledge, this hasn't been done nationally. Of course, this is a very new emerging law surrounding coronavirus. This is a new disease process. We're all still learning about it. This is new in our country and this is new in our region. And we're working together to get the answer right and move quickly.
Maybe Spring, maybe you can answer this. I know there's so much that we still don't know about this virus, but reading the CDC, it looks like you have to have close contact with people. If you are in the room with somebody who potentially has been exposed to coronavirus, can you get it?
So there's not enough known that definitively says one way or another. However, it's less likely. And so close contact is more likely to create the potential for transmission. And so that's why we are focused on people who have symptoms. And so anyone who has engaged in one of the locations that we've talked about that does have symptoms should in fact call us and we'll engage further with them. But people who do not develop symptoms sort of past that point, and the family has been in contact and has also not developed symptoms. And so we really want to emphasize that we at the health department are here to be your partner, all of the county residents to be your partner as how we walk through this space. And anyone that is concerned about this, we will deal with you directly with information that you have, and so we can customize it to your specific situation.
Do we know where?
Please call.
Do we know where in Italy she was? I know you guys.
I don't have it.